The total number of cases in our province is 427. There have been no new recoveries since yesterday, leaving 27 active cases in the province. And in total, we have tested 82,530 people. All individuals are isolating and contact tracing is underway. 3 of the cases are related to a previous case, and the remainder are under investigation, but it is still in the very early hours of the investigation. Therefore, we may still find that more of these cases are connected. Several of these individuals attended Mount Pearl Senior High, and the school has been notified, and public health officials are providing guidance regarding testing and self-isolation. If you are a parent of a student attending this school, you will be receiving information from public health and school officials on what actions you should take. We have a significant number of contacts associated with these cases through the school and various sports teams. Public health will be making contact with the teams impacted, as well as other close contacts, to provide guidance. Eastern Health is working diligently to conduct the contact tracing and notify contacts. I know this is a very stressful time for many individuals, and I ask for your patience as public health works through the significant volume of contacts. If you have been asked to get tested, please use our online assessment and referral tool to arrange for a test. The tool can be found at the top of our COVID website, and please only call 811 if you cannot access the tool. This assessment referral tool is the most efficient way to book an appointment for a test. If you have a family member in your home who must self-isolate, they must be separated from the rest of the family completely. They must have their own room with access to a bathroom that no one else uses, and they must not enter shared areas of the home. Meals must be delivered to them. If this is not possible within your home and the person cannot isolate in another location, then the whole family will have to isolate together. Please take this into consideration when you're planning for your isolation. As a result of contact tracing as well as exposure notification for the Biggs restaurant in Mount Pearl, we have had over 2,000 individuals in Eastern Health Region come forward to request a COVID test. We expect many more as we work through the contact tracing process. As a comparison, we generally have less than 400 people tested in a 24-hour period. In response, Eastern Health has opened a temporary drive-through COVID-19 testing clinic at 50 Mundy Pond Road. The hours have also been extended for the drive-through clinics located at the Janeway and the Waterford Hospital. Please note that you must have an appointment to have a COVID test. At this time, we have 3 non-epidemiologically linked clusters, which are cases without an identified source. This signals to us that we have community spread in the metro area, the extent of which we do not know at this time. In response, I am announcing special measures orders that will implement restrictions in the St. John's metro area taking effect immediately. Group and team sports and recreation activities where children and/or adults gather in person and where close contact is required are suspended. This does not include individual activities such as walking tracks, gyms, or private lessons. Group arts and cultural activities that involve in-person gatherings are suspended. This includes bands, choirs, dance, and music classes. Solo performances and individual lessons are still permitted. Based on the epidemiology of our current cases, we know that these are the primary areas of risk right now. We will continue to evaluate the situation over the next 48 hours and will determine if additional restrictions are warranted. We know that residents of congregate living facilities for seniors are at the highest risk for severe effects of COVID-19. To that end, in an effort to protect the most vulnerable, today I'm announcing a special measures order that will reduce the risk of COVID transmission to long-term care homes, personal care homes, and assisted living facilities in the St. John's metro region. Visitation will be reduced to 2 designated visitors per resident. Group activities will be suspended, and activities outside of the homes will be suspended. Residents admitted from the community will require screening, testing, and isolation prior to admission. And staff will not be shared between homes except in urgent situations where direct resident care will be adversely affected. Thankfully, I am pleased to report that all residents of long-term care homes in St. John's who wish to receive the COVID-19 vaccine have received the first dose. Community spread is what we have tried to avoid for so long, but it does not have to be our fate. We have it in our power to bring this back under control, but we can only do so if we know about all of the cases of COVID in our province, and that is only possible if people come forward for testing. If you have symptoms of COVID-19, please use our online assessment referral tool to arrange for a test. A mild cough or a fever is enough to warrant a test, but you should also get tested if you have 2 or more of the following symptoms: headache, sore throat, painful swallowing, runny nose, diarrhea, loss of sense of smell or taste, unexplained loss of appetite, or small red or purple spots on the hands or feet. With community spread in our midst, we need to behave like we did in April by assuming COVID is in your community. We all need to follow the public health measures. Practice physical distancing between yourself and those who are not your close contacts. Wear a non-medical mask of at least 2 layers in indoor public spaces. Do not take the mask down to be heard or make a phone call. Wash your hands or use hand sanitizer upon entering and exiting establishments. Work from home if you can to minimize the number of contacts. Stay home if you are unwell, even if it is just a mild cough. If you're in the St. John's, Mount Pearl, and surrounding metro area, please reduce your contacts and avoid gatherings. Stick to individuals in your own household as much as possible. I cannot stress enough the importance of this measure. As a recap for those who may have just joined us, we have 11 new cases since yesterday's media advisory, and the total number of cases in the province is 427. This turn of events, while entirely unwelcome, is not unexpected. We have seen other jurisdictions in this same situation that have managed to reverse the trend. We have the control. We need everyone's help to turn this around. Thank you, and hold fast, Newfoundland and Labrador.
Well, thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for some comments.
Thank you very much, Premier. Well, we're in day 338 of the pandemic, and we have unfortunately achieved another milestone, that of obvious community spread related to this spike that we've seen over the last couple of days. I'd like to take this opportunity to thank Eastern Health for the speed with which they have ramped up. These things always seem to happen on a weekend, and yet always the regional health authorities step up and enact the planning that they have done so diligently in the background. I have been in discussions with the department and through them with Eastern Health. There are no issues around testing capacity. The public health lab can run 24/7, and there are adequate supplies of swabs and reagents and PPE in the supply chain. We have rapid test kits, should public health regard those as useful in this situation. But quite frankly, given the proximity of Mount Pearl and Metro in general to the location of the public health lab, there isn't an awful lot at the moment, I'm advised, to be gained by using such techniques. So again, thank you to those public health staff and emergency operations centre staff who gave up their weekends once again to make sure things were available to run swiftly. I think one of the challenges, and Dr. Fitzgerald and the Premier have alluded to it, is around information. We, as official organisations, are bound by certain legislation and certain regulations. We have to balance speed with accuracy, and we have to balance privacy with public health needs. And we have striven hard to do that. I think yesterday It's unfortunate that our media advisory was delayed, and I think that void generated more comments and more speculation than was necessary had we been a little quicker. And I will work hard with the staff in the department to ensure that every day at the appointed time some form of information goes out, even if, quite frankly, it is to say more to follow. I'd like to thank mainstream media. They have been extremely restrained and very responsible in waiting until official sources had provided them with information. And they have been really good about avoiding speculation in public. We've always known that a spike like this or community spread could happen. And indeed, some of the planners in the regional health authorities really had been waiting for this. So that, I think, has enabled us to be ready to ramp up to meet the circumstances. They were prepared to respond. We have a plan, and Dr. Fitzgerald has now outlined the public health responses that are appropriate for this level of concern and numbers. I spent time on the phone today with the mayor of Mount Pearl, and they are obviously concerned. But his calm demeanor and determination to be guided by public health and best practices was very reassuring, and I think he again will become another trusted source of information for the citizens of Mount Pearl in general. That help and that calmness will help generate confidence, and we, for our part, will do our best to keep updating as and when information changes, and we are sure that it is accurate. Follow the recommendations and the guidelines. Follow the special measures orders. We've seen other jurisdictions in Atlantic Canada wrestle community spread to the ground by firm, decisive action in the early stages. And I think Dr. Fitzgerald and her team have provided us with those firm and decisive actions. I think the recommendations on a personal level that Dr. Fitzgerald read out are those almost identical to the ones that were read out over the last 10 months. And again, I would reiterate at this point, if you have any symptoms that fit into the category of COVID, you should use the online form as your first port of call to organize a test. We will identify cases in the community more by testing than we will by people sitting at home and hoping things will go away. And whatever the situation, whether your symptoms are sufficient or not, if you are not well, you should not go out of the house, period. So again, I would echo what Dr. Fitzgerald has said. We can get through this. Other provinces have done it. We have done it, and we'll do it again. So hold fast and hold the line. And with that comment, Premier, I'd pass it back to yourself. Thank you.
Well, thank you, Dr. Haggie. We'll now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you've noted now that there is community transmission and spread through the metro region. At what point will we be looking to revert back to alert level 3?
So right now what we're doing is, and we've said this from the start, we're trying to be as focused and as localized as we can in our responses so that we're not shutting everything down. So we're looking at where we're seeing this spread, where we're seeing these cases, and trying to make our measures in keeping with that. We're still very early days in this investigation, so if we start to see that there is if we can't link these chains of transmission together, if we're starting to see that there is more widespread community transmission, then we will have to consider more restrictive measures at that time so that we can reduce contacts and we can get this under control. We've seen that this works in other areas, in Brunswick, in Nova Scotia, so we don't have to reinvent the wheel here. We can we can certainly, put things in place like they have done and see success, I think.
We know that Mount Pearl Senior High is the school that's currently affected by this, and there's no in-class has been suspended at this point. But we also know that students don't maintain a bubble of just Mount Pearl Senior High. Often they'll play sports with kids from other schools. How widespread are we anticipating this to be? Are other schools already being notified?
So at this point, as I said, it's still very early stages in the investigation. There were a lot of contacts that Public Health had to trace down. So I'm not on the ground doing those investigations. I don't have all of that information at this time. But certainly, if at any point we feel that another school has to be notified, that will happen. And I'm sure, then the public will be aware of it.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
With that uncertainty that there may be other schools affected, why not decide to close other schools until that contact tracing and that investigation can be done?
So at this point, we're basing our measures on the information that we have. Today's school snow day, of course, gave us a little bit of breathing room to be able to do some of that contact tracing. If we have to close other schools, we will. But I think we need to have the evidence to support doing that before we make a blanket statement.
And a question for Mr. Fury. There are some people who are now going to have to be in isolation and aren't going to be able to vote on Saturday. As the person who was responsible for making this election call, do you regret the timing of this election, and what would you say to people who, because of this, won't be able to vote?
Look, as I said when we called the election, this was a decision that I struggled with. I understand one thing we all understand with respect to the COVID-19 pandemic is the uncertainty. We made that decision at the time based on low numbers, and let's be clear, we still today have relatively low numbers. It's concerning, and I understand the anxieties today, but in a global sense, I have every faith in the public health officials that we can continue to navigate this, control it, contain it, and trace it. With respect to individuals who are isolating, Mr. Chalk, of course, runs elections. I don't run elections, and he has given us the assurance that a COVID scenario election was one that was doable. And when you look around the country at other jurisdictions that have held elections, full provincial elections, like Saskatchewan and British Columbia, and with a higher burden of COVID-19 than we currently have here today, it's doable. And I gather from some of the media statements that he's made that he's confident that it is. And following public health guidelines is paramount in order to ensure that we can continue to navigate this issue right now.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. The reference to musical performances, does that expand outside schools? Are we getting into the bar situation here? I know the Bigs is a restaurant or bar, but as far as public facilities and bars and restaurants and all that sort of thing, at what point does that become a concern, and does that include the musical performance?
So at this point, no. What we're talking about would be, group sessions where people are getting together. We're seeing some spread in younger people, and we're seeing lots of contacts in that group. So our concern here is really about trying to reduce those numbers of contacts and to reduce potential spread of any cases through those younger age groups. But, we do have to be concerned about adults in that situation as well. So hence the reason why we have it for both children and adults. But at this point, we're not seeing spread in the bars. But, as I said, if this is still early days, so if we start to see that there's increased community transmission, we may have to look at restrictions differently.
Thank you. And do you have a number now on the amount of people, the number of people? I know there was after the cluster a couple of weeks back, we talked about 160. Do we know how many people currently now are either self-isolating and or quarantined?
I don't have the precise number. It's hundreds.
So high hundreds?
High hundreds, yes.
So you wouldn't go as far as, say, 1,000?
I don't know for sure.
Okay, thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, I was hoping you could clarify something you said earlier in your introduction. You mentioned 3 non-epidemiologically linked cases. And I'm curious, does that include the previously case that was under investigation a week and a half ago?
Yes, it does.
Perfect. And Minister, now that the government is in a caretaker role, are you still able to continue extending the Public Health Protection and Promotion Act?
I'm advised by Executive Council Act that the authority of the Minister to act in an emergency or in the public need exists, and I remain Minister until a replacement is sworn in. So the short answer is yes.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, Dr. Fitzgerald. How do you explain such a long window of possible exposure at the Biggs restaurant? We're talking about a 2-week period, and usually it's only a 2-day previous to symptom transmissibility.
Yeah, so in the Biggs, in that situation, because we had a case where we didn't have a source, what we were doing there was source tracing. We weren't actually, we did some tracing to look for, period of communicability as well, but it was really about trying to find a source for that case. So that's why we went back so far, because the incubation period is 2 weeks, right? So we had to go back about 2 weeks prior to the onset of symptoms.
Okay. And are you aware of any violations of pandemic orders that have been committed because of these cases? And I'm thinking particularly of the 20-person cap at events, informal events.
Sorry, the 20-person what, Peter? Sorry?
The 20-person cap on informal gatherings.
Oh, okay, sorry. So I'm not aware of there being any violations at this point, but as I said, still early days in the investigation.
Thank you.
Our next questions are from Jean-Philippe Hughes with Radio Canada. Please go ahead.
Hi, my question is for Andrew Furey. I'm just wondering, what are you anticipating as the impact on the election Saturday of these new cases announced today?
Well, we've said from day one that our team, and I've been assured by other parties that their teams as well have been following public health guidance and advice. We need to continue to do so diligently throughout the election campaign. We knew this was going to be a COVID-19 style election, so my party, for example, has pivoted, especially in the Mount Pearl area, to more of a virtual style campaign, and I think that's prudent and responsible. We all recognize that there had to be an election within the next 6 to 8 months. There's no way to fully predict the burden of COVID-19 and when things happen. I mean, we've seen that around the world. We have some of the best public health officials and public health advice here in Newfoundland and Labrador, and we've been following it. And it's one of the reasons why we're able to right now talk about numbers that are concerning, of course, and I would never say that they weren't, but really are the envy of other jurisdictions. I have every confidence in Dr. Fitzgerald and her team that they will get us through this in a safe, in a reasonable fashion. And I don't think that it will have, I hope, it won't have a great impact on the election on Saturday.
I have a follow-up for you, Mr. Furey. So we've just learned that hundreds of people are right now self-isolating or quarantined. But what are the options for them for voting on Saturday? Are they still admissible for some sort of online voting, or have they just lost their vote?
Yeah, Mr. Chalk is in charge of administrating of elections. I'm not, and I would never, ever interfere. So those questions are best directed towards Mr. Chalk. But as I gather from before, him and his team are fully prepared for COVID-style election, and presumably in his thinking moving forward about an election, because there had to be an election within the next 6 to 8 months. That's the law, so there had to be one. So I'm assuming Mr. Chalk and his team thought about different scenarios of COVID-19, including areas of clusters like we've experienced in the past. But again, I have confidence in Dr. Fitzgerald and her team that, as we've seen other clusters around the province, that following their guidance and their advice, we can tackle this one as well.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Given the growing situation, particularly in Mount Pearl, and when it comes to the senior high school there, is it still appropriate to have polling stations in schools this coming weekend?
Again, a question perhaps best directed towards Mr. Chalk and his team.
Sorry, I should have said that was for Dr. Fitzgerald.
Yeah, thanks. Okay, I thought it was towards me, Kellyanne, but I'm happy to turn it over to Dr. Fitzgerald.
Sorry, I should have pointed that, yes.
Okay. So, I mean, the school itself is not the issue. The building is not the issue. The issue here is contacts and people, how people interact with each other. That's how the virus spreads. So having the polling station in any building, as long as public health measures are followed, and as long as people are careful and people physically distance and wear their masks, that risk is still the same as what it was last week. So we just, the building itself is not really, it's not really what the issue is when it comes to the spread of COVID-19.
Thank you. And when it comes to the current active cases, and I know test results that go to Winnipeg, any, sign of a variant here at this point?
So we've sent off a fair number of our positive tests for variants, specifically with this. With these cases now, we have sent off ones that we can to be tested for the variant. To date, we've been lucky in that we've not had any, but we do have to assume that any of these cases could be the variant. So, we are leading with that mindset, but so far we have not seen any cases.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question about testing. The minister mentioned that we have the testing capacity. I've heard from people who test, they've called to get a test and they're being booked for Thursday. So can you give me an idea of how long the wait is right now for testing, and how concerned are you about those times, considering the longer you wait to get a test back, the longer you then have to wait to do contact tracing, et cetera?
Minister?
I'll take this. Sorry, Janice, do you want to take a stab at this?
No, I said I think you're best to take that,
I think
Minister.
it was directed at you, yeah. Thanks.
Okay. No, some of the information that's provided on the form allows stratification of risk. So those people that Dr. Fitzgerald refers to as immediate contacts of a positive case, their tests are done with minimal delay. Those people who are contacts of contact, or who are part of this backward tracing exercise, looking to find the source in Mr. Biggs, whilst useful and important, they are of a lesser priority, because as one of your colleagues pointed out, their exposure was well over 2 weeks ago. So we're actually testing for two reasons here. So a test that is scheduled down the road is scheduled down the road for a public health and clinical reason, not necessarily because of capacity.
Thank you, Minister.
And can you give us an idea then, what is the capacity? How many tests a day can we do, both from the lab capacity but also from the putting swabs in noses?
My understanding from the lab, running 24/7, is the figures are around 2,000, potentially 2,300 tests per 24-hour period. And
what about the actual swabbing?
That is not an issue because if more people are needed, people will be drafted from other areas. That's an operational question, more appropriately directed to the health authority, but they have not informed me of any constraints.
Okay, thanks.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Given the unknown, it's been mentioned a few times that we just don't know the extent of community spread here, and there are hundreds in quarantine, hundreds at least in self-isolation or quarantine. Are you just waiting for numbers to decide if an election is safe? I mean, the Premier said top safe, health and safety is the priority. We hear that a lot, but I mean, we have 11 new cases today, and there was an assumption on many that that would be more than enough to at least cancel or postpone the election, given the amount of people who can't vote because they're isolated, rotational workers are in isolation, can't vote, and so on.
So there was many different options to vote beforehand for rotational workers and others, and it's important to maintain anybody's franchise and ability to vote moving forward. But again, we've seen a higher burden of disease and higher levels of epidemiological spread in other jurisdictions around the country who have had elections, and I'm assuming, and again, it's best directed towards Mr. Chalk that him and his team have considered all these different scenarios going into a COVID-19 election. They informed us that they were ready for a COVID-19 election. We knew it wouldn't be a traditional election. We knew there would be different variables at play, and I'm assuming he's talked to other chief electoral officers around the country. But again, I wouldn't want to speak for him. I think that is best directed towards Mr. Chalk.
Thank you. And Premier, just a few moments ago, you also mentioned that candidates, at least for the Liberal Party, will be switching mostly to virtual in the Mount Pearl area. But given the community spread, I mean, Mount Pearl is not in a vacuum there. I mean, people are back and forth all over the metro region. Is it just limited to Mount Pearl that they're going to go virtual, or would it be safer for them to do it across the board?
I know we're monitoring that as data comes in, as cases come in, but from the beginning, we've been encouraging a virtual style campaign. So this won't be a difficult pivot for the candidates within the Liberal Party. We've been telling people to do as much as they can virtually. I know there was some door-to-door at times in particular districts, but you're certainly right. There's no wall between Mount Pearl and the surrounding areas, but that's why we're looking at these numbers as they come in closely, and we'll adjust immediately when appropriate.
Thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. When you see this type of spike in cases with hundreds in self-isolation, what type of strain does this put on public health resources?
Certainly, it means there's a lot more contact tracing to be done, so that takes a lot more manpower to be able to do that. But our public health team in Eastern Health is quite good. This was the same team that dealt with the outbreak in the very early stages of the pandemic, when we knew not nearly as much about COVID-19 and how to control it as we do now. So, I think we are certainly watching that very carefully. We have options available. If we need more contact tracers, we can bring other people in. But at the moment, Eastern Health is faring okay.
Thank you.
And doing an incredible job.
Right on. And I'm curious, has there been any update on the presumptive case associated with the daycare in St. John's?
From 2 weeks ago?
Oh, yeah. So that's a long time ago. So that case was confirmed positive, but no implications for the daycare at that time.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Dr. Fitzgerald, we've asked you about election safety. I'm wondering, would you approve of candidates and volunteers driving voters to and from the polls on election day?
So at this point, we would not recommend that people would be driving in cars with people who are not in their bubbles, not in their household, or somebody who, was in their extended bubble, we'll say. But so I think, people, it's unfortunate because I know that a lot of people do rely on the means of transportation to get you to the polls, but certainly I think we'll have to reach out to people that and try to keep your contacts as small as possible.
Thank you. And Mr. Hagee, I know you've brought this up many times before. How do you feel about private citizens posting unverified information online before it's confirmed by health or education officials?
We have a freedom of expression here, Peter, and far be it from me to try and constrain it. I would have thought common sense would have suggested that we've had our share of fear-mongering. I mean, you remember we had that video of the Latios at St. John's Airport making out no one was there to meet them on their flight, which turned out to be a total fabrication. And then we had panic in Bonavista, I think it was, when alleged plates appeared. So I think it's people's natural tendency to want to share and be sociable, but I think there is an element of responsibility here that has to occur. And as I say, our challenge is that as a government organization, or as an official response, we have to make sure that what we say is accurate. We have to make sure what we say is appropriate, and it needs to respect that balance between privacy and public health. It's a fine line, and people are often unhappy with the way we walk it.
Thank you.
Our next questions are from Jean-Philippe Hughes with Radio Canada. Please go ahead.
Hi, I'd like to have some precision about how do you define Metro St. John's area? Could you just let us know what's the zone exactly?
So we define Metro St. John's or the metro area as being basically CBS, Conception Bay South, east, and then Witless Bay north. So basically the outside tip of the Avalon Peninsula.
Thank you.
Jean-Philippe, do you have a follow-up question?
No, I'm good. Thank you.
Thank you. I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
I do. In looking at how large that this contact tracing could be, and especially noting that Mount Pearl Senior High has more than 900 staff and students there at one time, how long are you anticipating the school to be closed for?
At this point, we're still really early in the investigation, so it's difficult to say. It's going to be a couple of days for sure. We want to get people tested, so but exactly how long at this point, we can't say.
Thank you.
Peter Cowan with CBC, do you have a final question?
I do for the Premier. I'm wondering if you're able to give us an update on the status of Chromebooks. Have they been deployed to students, for example, in the metro area, to allow a pivot to online learning?
Some have not. I've been talking with the Minister of Education, and we're changing the strategy to ensure that they're getting into the hands of the students who now need them the most. They were being deployed around rural Newfoundland and Labrador first, and based on a needs assessment prior to distribution. And so now we're deploying those in the metro region more quickly. I've been informed by the minister, and after discussions with the Eastern School District, that Mount Pearl Senior High will be ready to transition to level 3 for them, which would mean online learning in a matter of days. Again, this scenario, like the schools, like the election, like many of our businesses, has been thought about and planned for. And again, with leaning on Dr. Fitzgerald and her team, I think that we can get this up and running if needed very quickly.
Thank you.
Brian Callahan with VOCM, do you have a final question?
Yes. We've just learned, I guess, that there's another large group of people, namely seniors or people without transportation or even mobility issues. We know how elections work. Every party has drivers to get the vote out, and that happens a lot, and it can be hundreds, thousands of people who may not be able to get there. Now, I know that you've been directing questions to Mr. Chalk as far as elections, but of course he's not a health professional, and at some point you must be consulting with him on these decisions around the election. So can you take us inside that discussion?
That's for Dr. Fitzgerald, is it, or for me?
Yes, please. I guess Dr. Fitzgerald, please. Sorry.
So with regard to the election, public health is involved in a consultative role in that the elections officials develop a plan, and then members of the public health team will review that plan and consult on it to make some suggestions with regard to any improvements that they see that could happen or any gaps that they recognize, and then send that information back so that it can be acted upon. So that's the process that happens really in that consultative process. So I don't know that we can say we've been in great discussions. It's really just been about making sure that we've been able to provide input to the plan that was developed, which is what public health has done with many organizations over the past year.
I'm sorry, and just to be clear, the final decision whether to postpone or cancel that election would lie with public health officials or Mr. Chalk?
Mr. Chalk.
Thank you.
Elizabeth Witten with All Newfoundland Labrador. Do you have a final question?
Yes. I'm wondering if there's been any progress on getting whole genome sequencing in the province.
So that's in progress. We are hoping that it will be up and running mid-February. So, it's getting close. I don't have a definitive date, though.
Thanks. Peter Jackson with The Telegram. Do you have a final question?
Just one final question. You have an extra testing site set up at Monday Pond Road now. Are there any plans in the works to open other testing sites?
Certainly the Eastern Health is looking at those options, and I think probably exploring those options as we speak, but I don't have any definitive answers as to where at this point, Peter. But we'll certainly be letting people know when we do.
Thank you.
Jean-Philippe Hughes with Radio Canada. Do you have a final question?
No, thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you for joining us today for the COVID-19 update. I want to stress to everyone to please be kind to each other. Because someone has a positive COVID-19 test doesn't mean that they need to be shunned or harassed. It's important that everyone feels safe to come forward to get tested for COVID-19. Dr. Fitzgerald and her team will ensure that that is the best thing we can do to contain and control this. I know there's a lot of anxieties out there. I feel it too. But please seek help if you need it. Look after each other and your neighbors where possible, and please stay safe, Newfoundland and Labrador.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other. Enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.
Tearing it up on four-wheelers. Not a big deal that we haven't caught anything today. Today was just as much of an ATV trip and a hangout trip as it was a fishing trip. We just wanted to hang out for a bit.